Okay, so with all that, we'll do this process again, and I'll stick it in the portal underneath the main recording. And so just think about, even before we go into the subconscious, think about what is it you want? Like, what do you want? It's a strong statement, I think. What do you want? My grandmother used to say, ¿Qué necesitas, mijo? Which means, what do you want, my little boy? So what is it that you want? And that's the conscious mind thinking of what you want. So now let's go underneath the conscious mind into the subconscious and what's called the superconscious, like God. And what do you want? Okay, so go ahead and you can close your eyes if you want, and you don't have to, and have a white window frame around your right eye, and you're looking through it. One more piece about this, why we're doing these things that seem kind of funny, white window frame, looking through it with your right eye. Dr. Naram talked about making ghee, making a supplement. He was making an herb and preparing it for women's health issues, hormones. And the other scientists that were working with him, they scoffed at him because he said, we want to make it under a full moon with certain parameters, like everybody's silent, everybody's in a good mood, and under a full moon. And they're like, we're not going to do that. That's stupid. And he turned to him and said, you're a fake scientist. And they're like, okay, we'll test it. And so they tested it. And they had some of the supplements that they prepared under the herbs under a full moon, and some that they didn't do it under a full moon. They did it just regular time. And the ones under the full moon, they tested it in the lab, and they were 20 times more powerful. And they tested it on the women with the severe menstrual and women's health issue stuff. And the ones that were taking the stuff that was made under a full moon had really great results, spectacular results. And the other ones had much, 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 much less results. And so then these scientists were like, okay, we get it. We don't know why, but we tested it. And when we do it under the full moon and we're silent and we're in a good space, the stuff works better. So today's the full moon, and I'm going to make my ghee today. And I'm going to do it in silence in a good mood. Because it's been tested. So we're doing these really funky little processes, and I don't know the reason why all of them are, but they're for a specific reason. So let's go again. The white frame around your right eye. I'm going to tell one more story too. I just got to, and look through the white window frame with your right eye, and just notice getting everything you want. So what do you want? And just see it in your mind's eye. Getting everything you want. I have a friend I was running with a couple weeks ago, and I found out he had a severe neck pain. He has had it for years, I think. And so I said, well, we were going to stop halfway through the run and then run back. I said, I'll work on you. And so I had him test, of course, his range of motion and how he felt. And then I did some of that light touch stuff. And as I was doing it, he was scoffing at me like, what are you doing? This doesn't do anything. This is ridiculous. I said, well, let's just test it. And so I finished my little treatment, and I said, so let's test it. Let's see how it's going. He goes, it didn't do anything. And I said, you didn't move your neck. You didn't test it. And so then he tested his neck, and he kind of smiled like, okay, it's better. But he was still kind of almost irritated and scoffing like, but why don't we push harder? So he didn't know the mechanics and the physiology of the whole thing, but because of his preconceived ideas that you got to push hard on this spot, his mind already said it didn't work, but he hadn't tested it. Isn't that wild how we work? So after he was done, I knew he was going to feel different. He moved much better. His pain was way, way less. And I was stopping, and he was continuing on. And I said, test your running, see how you feel the rest of the run. And I haven't seen him since. He was out of town this week. But it's kind of interesting to think that, yeah, it doesn't work. You didn't test it. So it's just interesting how people are. So I just insist on testing and then retesting. So, okay, so here we go. Back to our work. Looking through the white window frame. What do you want? And then take your right hand and pat your heart with your right hand 6 times and think very good. And then this the same distal end of the right index finger, but a little closer to the knuckle. Squeeze it 6 times. And look through the white window frame with your right eye. What do you want? And it's cool to write it down, especially when you get a really good one, like an epiphany. What do you want? And then take your right hand and pat your heart 6 times and think very good. And then squeeze the middle segment 6 times. And having everything you want, what will you do and who will you be? And see that through your right eye, white window frame. What will you do and who will you be? And then take your right hand and pat your heart 6 times and think very good. And then squeeze the proximal part of your right index finger 6 times. And having all of that, what do you want your life to look like? What will your life look like? Good work, everybody. I was just thinking how you guys are the ones that do the work. You show up and you do the work. I was at my friends who are homesteaders, and they were processing their apples and making it into really good apple cider. And I met with this one woman who was there, who I know, who's been dealing with a lot of chronic illnesses. She makes t-shirts, and we talked about us having her make our t-shirts and stuff. And I did a little of my session on her, the little light touch thing. And she had a profound shift, loved it. So I made sure I had her phone number, and I said, called her. And I also said, send me an email, or send me your email, because I want to send you a bunch of these free things. So I was going to send her all this free stuff to do these techniques that just had a profound shift on her. And she didn't email me. It's been a week. Didn't email me. I thought, wow, I could reach out. I could insist she'd get my free stuff. But I thought, she didn't even reach back. But you guys are here. You're doing the work. You're reaching out. You're doing the thing. Many people, for some reason, don't. I don't know why. Okay, so having everything you want, what will you do, and who will you be? And then take your right hand and pat your heart 6 times and think very good. Oh. And then take your right index finger, the distal end, and squeeze it 6 times. And 3 questions in this order. If you knew you were going to die in 6 months, what would you most want to do or be? And if you knew you couldn't fail, what would you most want to do or be? And if you had $10 million in your account, in your business, in your account, and you didn't have to work another day in your life, what would you most rather be or do? What would you most rather do or be? And then take your right hand and pat your heart 6 times and think very good. And that's the process. It could be called what do you want process. And then let's do 2 more points for clarity and peace of mind. So very right index finger, center of your head, between your eyebrows, slightly above your eyebrows. Press and release 6 times. On the last time, take a nice breath and then let it go. And then press and release 6 times. And after each breath, take a breath and relax and release. And for more peace, right thumb, left hand behind your head, press and release just below your nose 6 times. And on the last one, take a breath and relax. And then a separate system that's very, very powerful for deep meditation is we have that light touch just below your your soft neck, the first flat bone. Super lightly touch it like you're touching a butterfly, and then super lightly bring it up towards the sky. And then the thumb and middle finger just below the head bone, just below the occiput bone, that first soft part on either side of the spinal cord spot, center line, just touch and then bring it up. And then bring your attention in your body and just sit in stillness and notice what's happening in your body. Stay out of your thoughts. Stay in your body. Let go of all distracting thoughts. Feel your body inwardly. And then you can ask that question, who am I? And just watch, just notice. Stay out of your thoughts, stay in your body. And you can ask that question, who is it that's watching? Who is the watcher? And then for physical healing, also for other healing too, a few fingers on your belly button, super light, a few fingers on the top sternum part, super light, bring them up to the sky, and then turn your body to the non-dominant side. So if you're right-handed, turn left. If you're left-handed, turn right. And then bring your eyes back to the center, and then relax. And bring your eyes back to the center, and relax. And bring your eyes back to the center, and relax. And then bring your body to the other side. If you're right-handed, you turn right. If you're left-handed, you turn left. Bring your eyes to the left or to the center, and then relax. Eyes to the center and relax. Eyes to the center and relax. And come back. And then I encourage you to walk around and test for yourself. See if there's anything different in your physical body, in how tall you are, and how your feet are on the ground, and how your body moves, in the speed that you walk at, in anything, and just notice what you notice what's different. And then throughout the day, just keep an eye on it. And if you like, do this 6 to 9 times a day and make it your own. And let's test it. Okay. And I'll go ahead and click off the recording, and then we'll get right to, you'll have the full recording in the portal, but then we'll get to the one-on-one. So here goes.